Hello, my name is Shantavia, and I'll be performing a head-to-toe assessment for you today. First, we will scan the room to verify that there are no notes present. So at this point, I have checked the chart, provided for privacy, used hand hygiene, and now I will introduce myself and check for a two-patient identifier. Hi, my name is Shantavia. I'll be the nurse assisting in your care today.
Hello.
Do you mind if I see your wristband?
Sure.
Can you state your name and date of birth for me?
Brittany Cooper, 3997.
Thank you. And what brings you in today?
Just a general checkup.
Good. Are you in any pain?
No.
Okay. I'm going to ask you a couple of questions.
Okay.
So who is the current president?
Donald Trump.
And do you know where we're located?
My bedroom.
Lovely. All right, so at this time, I will note that Brittany's gait coming in was smooth. All of her movements were deliberate. She's well-groomed. Her behavior is appropriate for situation. Her affect is calm. She is able to open her eyes spontaneously. She was capable of following a command, and she's ANO ×3. With all of that noted, her ABCT and Glasgow's coma scale is rated at a 15. Now I will assess Brittany. So, have you had any head trauma?
No.
Injuries?
No.
Headaches?
No.
Dizziness?
No.
Nausea?
No.
Okay. Do you have any lesions, any scars, rashes?
No.
Okay. Have you had any trouble with your hair, hair loss, brittleness?
No.
Okay, good. So looking at Brittany, her skin tone is even throughout. She has full hair. Hair is appropriate for ethnicity. And now I will palpate. Noting that there are no masses or lesions and free of bugs. Her head is normal cephalic and symmetric. Moving to her eyes. So her eyebrows and eyelashes are evenly distributed. Her outer canthus of her eye is aligned with her ear. And now I will looking at her conjunctiva, our nice moist and pink, her sclera is white, and her pupils are round. Brittany, have you had any trouble with your eyes lately? Do you wear corrective lenses?
I do, yeah.
You do? When was the last time that you've been to the ophthalmologist?
About 6 months ago.
Okay, so your prescription is up to date.
Yes.
Have you had any floating objects?
No.
Any dizziness or blurred vision?
No.
Okay. With that noted, her cranial nerve number 2 is intact. I will now check for reaction. Okay, so Brittany's pupils constricted with the presence of light. Now I'll have you stare off into the distance and look at my pen light when it appears. Brittany's eyes appropriately accommodated. So at this point, her perla is all set. I will now check her 6 cardinal gaze. Can you look at my pen light, moving only your eyes? So Brittany presents with no nystagmus. Strabismus is not present, drooping of the eye. So with that being said, cranial nerves number 3, 4, and 6 are intact. Moving to her nose. Have you had any trouble smelling?
No.
Okay. Any change in taste?
No.
Any drainage? Sinus pressure?
No.
Okay. We're going to now check her patency. I'll have you place your nose over one nostril, breathe in and out for me. And the other. Thank you. So her patency is good. I will now look up her nose. Her turbulence are nice and pink. Hair is evenly distributed and appropriate for location. No septal deviation, and her nose is symmetric laterally. Now I'll palpate your sinuses if that's okay.
Mm-hmm.
Tell me if you feel and experience any pain.
Okay.
So, patient's sinuses are not inflamed. I will check for your temporal artery now, which is present with a +2. I'll check your TMJ. I'll have you open and close your mouth for me. She was capable of opening her mouth with no difficulties. No clicking was present. So cranial nerve number 5 is intact. After I check for each time that I touch you, can you state whether it is sharp or dull? I'll have you close your eyes.
Sharp.
Forehead.
Dull forehead. Sharp cheek. Dull chin. Sharp chin. Dull cheek.
Thank you. Patient was capable of correctly identifying sharp and dull sensations. So cranial nerve number 7 and 5 are intact. Now I will inspect her mouth upon me asking her some subjective questions. When was the last time you've been to the dentist?
Probably about 6 months ago.
Are you having any trouble with your teeth at all?
No.
Your mouth? Any difficulty swallowing, chewing?
No.
Okay. And I'll go ahead and have you open for me. Can you move your tongue to the left, right? Perfect. And can you move down for me? And up. Perfect. So her lips, gums, tongue, buccal mucosa, soft, hard uvula are all moist and pink. Can I have you say, and free of lesions or any masses? I'll have you say ah for me.
Ah.
And one more time, can you swallow?
My mouth open?
Perfect. So Brittany's uvula rose upon saying soft palate as well. Both her hard palate and soft palate are intact. The uvula did not deviate upon and she was able to swallow. So cranial nerves number 9 and 10 are intact. Can you say light, tight, dynamite for me?
Light, tight, dynamite.
Because Brittany was able to say light, tight, dynamite, cranial nerve number 12 is intact. Now I will move to her ears. Have you had any trouble hearing?
No.
Any pain inner outer ear?
No.
Okay. And once again, you said there's no dizziness.
Mm-mm.
Okay. So looking at Brittany's ears, they are free of lesions or any masses. They are appropriately sized for her head. I'm going to look in her ear. Which is free of excessive cerumen. Her hair ciliation was appropriate for location. And now I will push, pull, push on her tragus, pinna, and mastoid process. Any pain?
No.
Okay. Now I will perform the whisper test. When you hear a sound on either side of your body, can you appropriately raise your hand accordingly?
Yes.
Thank you. Patient was able to identify appropriately these sounds. Can you stand for me? Close your eyes. Yeah, thank you. Patient was able to perform the Romberg test with no swaying, so the Romberg test was negative. At this time, I will palpate her lymph nodes. Preauricular, postauricular, occipital, tonsilary, submandibular, submental. Turn your head to the left for me. Superficial, clavicular, cervical. The other side. Superficial, cervical. And tip your head in for me. Deep chain. The other side. Deep chain. Shrug your shoulders for me. Posterior cervical. And once again, posterior, supraclavicular. There were no palpable nodes present. If they were, they would be soft and immobile. Excuse me. At this time, I will test for skin turgor. The skin bounced back to where it was. No evidence of tenting, meaning that she's well hydrated. At this point, I will also note, go ahead and shrug your shoulders for me. And push your head against my hand from the other side. Thank you. Brittany was able to shrug her shoulders, meaning that cranial nerve number 11 is intact. She was able to use appropriate strength to move my hand, noting that her range of motion of her neck was well within limits, and her skin was warm and dry to the touch. Moving to her neck. Her neck is symmetric midline. Go ahead and swallow for me. No masses are present upon swallowing. And now I will palpate unilaterally her carotid. All right, and her pulse was at a +2. Now I will auscultate. So I'm going to have you breathe in and exhale. On the exhale, I'll have you hold.
Okay.
I'm going to listen with the bell of my stethoscope. And when you're ready, hold. Release. When you're ready once again, release. And there were no bruise present. And on palpation, no thrills were noted. At this time, we will move to her anterior chest. So, Brittany, are you having any shortness of breath, difficulty upon movement, any chest pain?
No.
Okay. Any leg edema?
No.
Okay. So, expecting Brittany's chest, there are no lesions. Skin is even throughout. She does have a tattoo on her right clavicular shoulder. Her skin is warm to the touch. Now I will palpate for crepitus. No crepitus noted. Now I will percuss within the lung fields, which is above the clavicle down to the diaphragm, starting right above the clavicle itself. All right, all sounds were resonant, and I will move to auscultating in those same locations. Using the diaphragm of my stethoscope. Each time that I move my stethoscope, can you take a breath in?
Yes.
Thank you. Break. Again. All right. So there were no adventitious sounds noted. No crackles, rattles, rails, or wheezes. At this time, I will listen to heart sounds, starting using the pneumonic abdomen, starting with the aortic, which is located on the right sternal border, second intercostal space, the pulmonic, which is the left sternal border, second intercostal space, Erb's point, which is left sternal border, third intercostal space, tricuspid, which is left sternal border, fifth intercostal space, and finally the mitral, which is fifth intercostal space midclavicular line. Using the bell of my stethoscope. And I'm gonna face if that's okay. You can lower your shirt. And at this time, I am noting that there are no heaves or lifts. All heart sounds were noted. S1 and S2 were in sync. No murmurs were present. As well as in every situation, you would auscultate on skin directly. Now, we will move to posterior. Thank you. Looking at Brittany's back, there are no lesions, bruises, skin is even throughout. I'm gonna move just a bit if that's okay. Looks like she has a tattoo on her right lateral side. And now I will check for crepitus. And mapping out the lung fields, it is from C7 down to T10. If you go from the scapula, 3 spaces here. While I'm here, I'll go ahead and check for symmetry. I'll have you take a deep breath in. My hands roll symmetrically evenly, meaning that there aren't any type of pneumothorax. Now, I will check her AP diameter. Coming from her lateral side of her chest above the diaphragm. Which is a 1-to-2 ratio, which is an appropriate finding. Now I will percuss. Starting in the same lung fields that I just mentioned. Starting over. Alright, all sounds were resonant. No evidence of any dull or fluid present. Now I will auscultate in those same fields. Her skin is also warm and dry to the touch. I'm going to use my bell, the diaphragm of my stethoscope to listen in those same locations. Every time I move my stethoscope, can you take a breath in for me? I'm gonna lift if that's okay.
Okay.
Once again. Brittany's long sounds were free of adventitious sounds, no evidence of wheezing, bronchi, or bronchial sounds or vestibular sounds were clear. Her bronchodivascular sounds were also noted as normal. And this time I will have you turn back around. I'll take a look at your extremities while I'm here, I suppose. So her arms are nice and dry to the touch. They're even throughout. It looks like she has the tattoos on each of her wrists. I'm gonna go ahead and palpate her. Do you have any muscle weakness?
No.
Any trouble doing daily functions?
No.
Okay. You haven't had any recent falls or stumbles?
No.
Okay. I'm gonna go ahead and palpate bilaterally her brachial artery, which are present with a +2. Her radial artery, which are present at a +2. Do you mind if I take a look at your hands? Checking for capillary refill. They return to normal color within less than 3 seconds, which is a normal finding. Can you grab my hand? Push, pull. Perfect. I'll have you close your eyes and put your arms to the side and touch your nose. Thank you. You can open your eyes, and I will now have you touch your nose and then touch my finger, and each time it moves, repeat. Patient was able to perform the task, meaning that her cognition is intact. I'm going I'm gonna skip to the abdomen. Let me have you lay down. So first I'll have you lay flat. And then I'm gonna raise you up just a tinge. At this point, we're checking for jugular distension, putting her at a 45-degree angle. There's no evidence of distension, meaning that her heart ejection fraction is doing well. So I'll have you lift. Okay, flat, come back. Perfect. So Brittany, are you having how are your eating habits? Are you eating appropriately?
Yeah, I'd say so.
Okay. Any trouble eating at all?
No.
Any difficulties in urination?
No.
When was your last bowel movement?
Today.
Can you tell me about the consistency?
It was like a soft brown.
Any mucus or blood in your urine or stool?
No.
Okay. When was your last period?
It was like 8 months ago.
8 months ago.
Mm-hmm.
Why so?
I have an IUD placement.
I see.
And
So
it stopped
when was the last time you've been to the gynecologist?
June.
Okay, good. So you're up to date there.
Yes.
And you perform regular breast exams?
Yes.
Okay, the same time each month,
Yes.
considering you don't have a period. Okay. Are you having any vaginal discomfort at all? Discharge?
No.
Okay. So at this time, I'm going to lift your shirt if that's okay.
Okay. Yeah.
And inspect her abdomen. So looking at Brittany's abdomen, there are her skin is even throughout. It looks like she has a umbilicus piercing, which is midline. Skin is true to ethnicity, and skin is warm and dry to the touch. No palpations or masses noted. Now, I will auscultate for each of the 4 quadrants a couple of times, starting in the right lower, moving to the right upper, thereafter the left upper, then down to the left lower, excuse me. Using the bell of my stethoscope. Diaphragm, excuse me. Are you in any pain?
No.
Brittany's bowel sounds were present in all 4 quadrants. Now I will auscultate for aortic, renal, and iliac sounds, locating that with a W starting here from the umbilicus, using the bell of my stethoscope. Aortic. I would typically also check for femoral, but for the purposes of this video, we will not. I would also palpate for a pulse as well. But there were no buoys noted on auscultation on all locations. So at this time, I will percuss several times, the same fashion as I auscultated, in the right lower quadrant. Alright, so all sounds were tympanic, except for in that upper right quadrant, which is expected based on the mass of the liver. Now I will lightly palpate. With Brittany not in pain, I will start in the same fashion, doing so. Upon palpation, there were no masses or any indication of tumors present. That concludes our abdomen. Thank you. So I'm going to go ahead and have you Lift your legs up for me. You can do them one at a time. Make it easy. Perfect. Outward. Thank you. So Brittany's range of motion was in normal limits. No skin edema is noted, no lesions, masses. Skin is evenly distributed throughout. It is also warm and dry to the touch. I will now check for capillary refill. There is polish here, but I can definitely still see it checking. Capillary refill was appropriate, less than 3 seconds, and return on each. I am going to touch your foot, and on each location, can you tell me if it is sharp or dull?
Yes. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Again?
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Perfect. And checking for Babinski's. Alright, patient was able to appropriately identify sensations, and the Babinski test was negative. At this time, can you stand for me? I don't think I need to do this. Technically, you can bend over.
Okay.
Touch your toes. Brittany's spine is in a line and her range of motion is appropriate. Oh, can you run your shin down the front of your knees? I mean, shin, thank you. Your knee, your heel down the front of your shin. You appropriately did that, thank you. And her range of motion was appropriate. And one more time, I'll have you sit. I will check for a popliteal artery, which is not present, which is a normal finding because typically they are not. Pedis dorsalis, present at a +2. And present at a +2. This now, do you have any questions for me, Brittany?
No.
And this concludes my head-to-toe video.